Today's health question is, what is a patient-centered medical home?
We're very fortunate today to have Dr. Robert Carr. He's the Vice President for Clinical Transformation, and Rowena Bergman, she's the Vice President for Clinical Integration and Population Health at Western Connecticut Health Network, to help answer this question.
Two very distinguished executives here with us today. Okay, well, yeah, what's a PCMH, or a patient-centered medical home, Robert?
So it's really a transformation of practice. It talks about how we can transform our practice to really focus on the things that are important to patients, so that instead of setting up a practice and then just hoping it meets the needs of the community and the patients, we really take an effort to assess our community, assess our patients, and design our practice around what really matters to the patient, good outcomes and a good patient experience.
And Rowena, in the patient-centered medical home, the practice is really accountable for the health of the patients. How do we know that? How are the ways that a patient-centered medical home proves that?
So you take a look at outcomes. You take a look at things like preventive care services and closing gaps in care. You know, of your population, of your diabetic population in your practice, how many are well-controlled diabetics? Of the women in your practice, how many of them have had mammography? So you're able to measure outcomes to make sure that you're meeting the needs of your population.
So in many ways, this is using big data to allow us to transform our practice, because we can be driven by those data.
And we also look at things like access. Can the patient get answers to their questions when they need to? Can they get an appointment in a reasonable amount of time? Are we
Is there a requirement for them to be able to get in to see someone within 24 hours? Isn't that one of the standards, or not?
It's not specifically within 24 hours, but it does have to be in a timely fashion. Every hospital or organization is able to kind of determine what reasonable is.
And even though we're using big data, we're focusing on individual patients in a team-based approach.
Exactly, and team-based care is kind of another one of the big tenets of patient-centered medical home, where everybody on the team, and the team can be physicians, nurses, dietitians, pharmacists, medical assistants. Everybody has a role to play, so that when a patient comes in, they're really getting a very comprehensive experience with everybody working to the top of their skill set to really provide high-quality care and an excellent patient experience.
And I think data shows so far that patient-centered medical homes get better care, and often for less money.
And also at greater satisfaction for the patient.
Which is, you know, there's no losers there.
Thank you. If you have a question for a doctor or would like to suggest a topic for a future show, we'd love to hear from you.
Send your question or comment to healthtalk@wchn.org.
Thanks for watching, and we'll see you next time.
Bye-bye. Stay healthy.